Hello, my name is Sven Stampf and I'm presenting this talk on behalf of my co-authors. This paper is about trust, identity, privacy and security considerations for designing a peer data sharing platform between people living with HIV. This work is part of an EPSRC-funded research project called Intuit, a 30-month design-led program to develop trusted systems for self-generated health and lifestyle data for managing how to live well with HIV. Our motivation for this work were threefold. Firstly, HIV has changed to a long-term condition, and typically people living with HIV only see their consultants once or twice a year. However, to stay well requires careful self-management. Secondly, existing research has focused extensively on information seeking, information sharing, and emotional and social support in digital health communities, but there's a lack of research into data sharing technologies. Finally, there has been a rise in people with health conditions using trackers that allows them to collect data about their lifestyle and health. We already know that many people living with HIV reflect on the data that they track and that they have questions around this. For example, is their CD4 count normal? They informally share their data with each other on forums to answer these questions. Our research investigated the possibilities for having access to each other's data. Our work concerns the gap in research about digital technologies to facilitate the sharing of such data and the implications for trust, identity, privacy and security, often abbreviated to TIPS. We adopted a mixed methods approach, conducting semi-structured interviews coupled with privacy rating activities. We recruited 26 people based in the UK. All sessions were audio recorded and transcribed. For the interviews, we conducted a thematic analysis. We quantified the ratings activities and conducted statistical analyses. In all research activities, we were aided by a peer researcher from the Terence Higgins Trust. In answer to what data they are willing to share, we analysed the ratings given by participants on the privacy rating scale. We found that participants were largely open to sharing a wide array of data types, for example, their personal data in blue, or medical data shown in red, and also lifestyle data shown in purple. All of these were rated around 70 or above. Data items that may reveal their personal identity, such as their name, were rated significantly lower than others. By sharing data and getting answers to their questions, they expected better communication with healthcare professionals, building better community, and also to enhance their own learning and self-monitoring. Their considerations around sharing data revolved around fostering trust by using credibility cues. They also told us that privacy and security needed to be ensured. Participants expected a platform to include privacy and security policies, and nearly half expressed their preference for sophisticated privacy controls. More than half of our participants also stated the need for strong security and identity verification. To sustain digital interactions and data sharing, participants wanted to see moderation of information, an explicit consent model, and reciprocity of data sharing amongst similar users. To summarize, our work contributes key considerations and recommendations to inform the designs of trusted platforms that are sensitive to the TIPS concerns of people living with HIV. We contribute an approach to investigating these concerns with health communities by working with a peer researcher. We encourage others to consider using privacy rating activities coupled with interviews. Our findings could also extend to other communities that live with stigmatized health conditions, but there may be important differences in how these communities operate, influencing the sharing of data. Thank you for listening and enjoy reading the paper.